So Cesar A. Alfonso is clinical professor of psychiatry at Columbia University, adjunct professor of psychiatry at Universitas Indonesia, and visiting professor of psychiatry at the National University of Malaysia. He is the chair of the World Psychiatric Association Psychotherapy section and a past president of the American Academy of Psychodynamic Psychiatry and Psychoanalysis. He chairs the AAPDPP Committee on Psychoanalytic Education. He has authored close to 100 articles, 17 textbook chapters, and 3 edited books, and given over 200 international presentations in Australia, Asia, Europe, Africa, and the Americas. Dr. Alfonso serves as editor of the Academy journal, Psychodynamic Psychiatry. Max, let's turn this meeting over to Dr. Alfonso, and go right ahead, Cesar. Yeah.
Thank you so much, Jerry, for that most generous introduction that I wrote. You know, this, you already heard the title of the presentation. So, and, you know, these are my credentials, and those were summarized in Jerry's biographical details. I'm also the chief psychiatrist at the Lighthouse Guild Behavioral Health. I've been working in that position for the last 15 years, serving people who are blind and have vision, a pretty significant vision loss. So these are how I share my academic time and how I invest my efforts. And this is what I do for fun on my free time. I am, you know, really blessed and so lucky to have the most wonderful co-editor, Jennifer Downey. We're in constant communication almost on a daily basis, and have really exciting conference calls regularly scheduled. And our most able deputy editor, Debbie Katz, who is always there to break the tie when there are differences of opinion, and also illuminate our way in with her multiple areas of expertise. And what an impressive team of people. We have close to 100 people helping us with great synergy to make the journal you know, what it is today. We changed the structure of the editorial board without changing the integrity of this central part of it, the large number of names that are listed there. We added research methodology consultants to help our now associate editor, Bernard Gorman, with statistics. And he basically chose a team of up-and-coming statisticians and methodology consultants that he has supervised over the years to help out with our research submissions. And we established a formal international advisory board that will be involved over, you know, the next few years in more visible ways. So moving on to the talk today, these are the learning objectives. This presentation will review challenges to object constancy and the integrity of the holding environment as a result of the widespread practice of providing psychotherapy over video. I will describe the cultural anthropological concept of proxemics and how the practice of distancing for proper infection control challenges the variable needs of individuals for intimate, personal, public, and social spacing. Hopefully, the presentation will enhance our awareness of the importance of language and nonverbal communication in psychotherapy by understanding proxemic theory and our basic needs for interpersonal space. And I will glaze over and discuss haptics, kinesics, paralinguistics, and chronemics, which are subcomponents of proxemics. and describe how disruptions in these dimensions can affect well-being. So nonverbal communication is the communication that does not involve the exchange of words. And a basic premise from an anthropological perspective is that information exchange, nonverbal communication, information exchange is outside of conscious awareness. The empirical study of various types of nonverbal communication has evolved over the years since the 1970s into the fields of proxemics, gramemics, vocalics, also known as paralinguistics, haptics, and kinesics. And this will be defined, and I will spend some time describing them. We will start with the person who paved the way for this aspect of cultural anthropology, and that is Edward Hall. And I selected here some important contributions. So if you want to read the book that that was perhaps his equivalent of Freud's interpretation of dreams, was The Hidden Dimension, written in 1966. If you want to read an article, a historically important article, you can read this article in Current Anthropology. And if you are interested in his life, as I am, and some of you may be after I tell you a little bit about his life, his biography, An Anthropology of Everyday Life, autobiography, is quite engaging. So let me tell you just a little bit about him. He was an American anthropologist who collaborated with the psychoanalyst Gardner, Eric Fromm, Frida from Reichman, Karen Horney, and Harry Stack Sullivan. He was a professor of anthropology throughout his career at different universities, including the University of Denver, Bennington College, and Northwestern University. And he lived most of his life in the United States, but also did field research with indigenous people within the US, and outside of the US, did field research in Micronesia, the Philippines, and in Europe. And what brought him to our radar as in our field of psychoanalysis and psychodynamic psychiatry is that he had a formal affiliation with the Washington School of Psychiatry when working with the Department of State in Washington, DC. And his wife became the administrator, sort of the Marie Westlake of the Washington School of Psychiatry. And his office, while he was working as an anthropologist consulting in the Department of State, was in the same building as the Washington School of Psychiatry. So, you can imagine how all of these minds coalesced and contributed towards the one of his main areas of interest then became, as a result of these coincidences or alignment, looking at the interface of psychoanalysis and anthropology, always interested in intercultural communication, and that's why he was hired to design a special program for the Foreign Service Institute in Washington to help State Department employees negotiate cultural differences when they took on overseas assignments. And he developed proxemic theory. And I never met him personally, but when reading his biography and talking to people who were able to work closely with him, apparently the gatherings and study groups that he would put together were not only for their own edification, but he would bring psychoanalysts to the Department of State to talk to diplomats and vice versa. So it was quite an exciting time for our field and the history of this particular form of syncretism. So what is proxemics? It can be defined as the anthropology of space simply, or also viewed as psychology of space as one of its subcomponents. It is the study of the human use of space within the context of culture, and different cultural variables create frameworks for organizing and defining space. His own definition from his landmark book is the interrelated observations and theories of humans' use of space as a specialized elaboration of culture. The biometric study of proxemic behaviors in anthropology examines various dimensions of interpersonal distance surrounding an individual at any given point in time, including the intimate, personal, social, and public distance. In proxemic theory, there are subdivisions of space surrounding the body. These include from proximal to distal, the body, home, interactional, and public territory. Navigating these spaces with psychological comfort greatly depends on emotional memories encoded after primal dyadic interactions. Those who were cared for and protected in a consistent, attentive, and nurturing way will venture out with comfort into the interactional and public spaces later in life. So here I'm taking the basic premise of attachment theory and intertwining the notion of navigating with comfort from the personal to the social to and eventually to the public arena. So interaction and interpersonal communication. And this is a quote from Hall himself. Like all basic studies of the communicative process, proxemics, as I think of it, is more concerned with how than why. It addresses itself to basic human situations in an area of culture that is ordinarily hidden from conscious awareness. For this reason, proxemics frequently leads to new insights about specific cultures, as well as to insights into the generalized concept of culture itself. In formulating my thinking, his thinking concerning proxemics, I have maintained that culture is an extension of basic biological processes. Well, you see his respect for Darwinian theory here as well. Biometrics is very important in fieldwork, proxemics fieldwork. The intimate space is acceptable only for romantic partners. The personal space entry is permitted for the closest friends and relatives. The social space is the space for conducting routine social interactions with acquaintances as well as strangers. And the public space is the area of space beyond where interactions are perceived as impersonal and relatively anonymous. So when we talk about social distancing and we look at the fieldwork of cultural anthropologists, and it is no coincidence that the term social distance was selected as the correct term in a very precise academic way. The social space usually in most culture averages 2 meters, and it's a space for formal relationships. But look at what gets compromised: personal space and the intimate space. So important for all of us, obviously for our patients as well. And this is a graphic depiction of the intimate space, personal space, social space, and public space. Our organizations of space are internalized at an unconscious level. Slight cultural variations may dissipate with globalization and now as a result of COVID-19. Failures of communication and psychic disintegration could result from deviations from proxemic boundaries and comfort zones. Proxemics remains a hidden component of interpersonal communication that is uncovered through observation and strongly influenced by culture. Hall stated that proxemic patterns, once learned, are maintained largely outside of conscious awareness. And anthropologists talked about sociopical and sociopital spatial arrangements. Sociopical spatial arrangements are orientations that push people apart, separating them. And sociopital are arrangements or orientations that pull people in, combining them. Sociopical and sociopital arrangements may increase or decrease interaction. He stated the arbitrary separation of the individual from others alters context and distorts meaning and may lead to alienation in encounters by altering the proxemic equilibrium. So hopefully our clinical correlations are beginning to resonate as we're talking about this and the work that we're doing with patients at this point in the history of our clinical practice. So sociopical and sociopital reversals may be disorienting, derealizing, and contribute to the fatigue of video interactions. The subjective sense of alienation in encounters may need to be interpreted or deconstructed for patients who were seen in the office and now are treated at a different distance. This is an entry from a paper by Hall, just to give you an idea of, I guess, the anthropologist's equivalent of the mental status examination. A US male stands 18 to 20 inches away when talking face-to-face to a man he does not know very well. Talking to a woman under similar circumstances, he increases the distance about 4 inches. A distance of only 18 to 13 inches between males is considered very aggressive. Yet in many parts of Latin America and the Middle East, distances which are almost sexual in connotation are the only ones at which people can talk comfortably. I always get a kick out of socializing with Argentinian colleagues who are among those who are most comfortable with very short distances in communicating with others. You know, they're literally on your face as they're speaking with you with great enthusiasm. The SPA axis is affected by kinesthetic factors, haptics, spatial factors, thermal factors, olfaction, and paralinguistic factors. And this is how the field researchers in anthropology code these interaction and the distancing. And this is just an arbitrary entry describing two men standing facing each other directly, close enough so that hands can reach almost any part of the trunk. Touch does not play any part. Man is speaking, looking at, but not in the eye. Partner only viewing speaker peripherally, close enough so that radiant heat would have been detected, body odor, but not breath detectable, voice very soft. So again, I'm inserting this slide here is to, as something that is reminiscent of how much more detail, you know, we can document or observe our interactions with patient when documenting a mental status examination. So this is a very large study that was relatively recently published, an international study of preferred interpersonal distances, a global comparison in the Journal of Cross-Cultural Psychology. And the findings from this study were, in general, I mean, these are the basic conclusions. This is a very gross summary of what's a very detailed study. Younger people and men in general prefer closer physical distance than older individuals and women. There are certain cultures that are referred to as contact cultures, and that includes Mediterranean and Latin American people. Non-contact cultures are Northern European and Asian. And this one surprised me, and I still cannot understand why, but hotter climates have higher needs for closeness, and also collectivist cultures. So if you're in a collectivist culture, in a hotter climate, there is a great need for, or a greater need for physical proximity. And these observations were, these conclusions were based on a study of 9,000 participants in 42 countries. And here you have, you know, a visual representation of the average social distance in different countries, personal distance and intimate distance. And as if you look at the, you know, just to focus on one, at the social distance, you see that the United States is, you know, somewhere in the range of 90 to 120 centimeters, you know, 2 meters. And Argentina, in the very bottom of the slide, is the one that is, you know, pretty much off the charts, with other variations in other countries. And this is just of academic interest, but, you know, to show you the extent of the field research that has been conducted by anthropologists. And this is a metaphor, you know, so to remind us that there is an evolutionary purpose to distancing. And if you look at the flight of birds in this particular coordinated formation, flight efficiency increases by 75%. So you can, if you didn't know this, now understand this as a very purposeful formation and distancing. And this is what my office, I should say our office, I'm sharing it with Tim Sullivan and Ramon Burgos. I don't know if Tim is in the call. And this was sort of intuitively decorated, but if you measure the distance between the chairs, it's close to the acceptable comfort zone of 2 meters. I'm shifting now to tell you about the contributions of Thomas Bruneau and developing the field of chronemics after proxemics was developed. And I have 2 publications here in case you're interested in the primary sources. The second one I highly recommend, Communicative Silence Forms and Functions, and I will spend a little bit of time telling you about, talking about silence. Chronemics is the study of the use of time in nonverbal communication. There are subjective aspects of time experiencing, and psychological time, biological time, social time, and chronological time perceptions are not always aligned. I remember learning this from Doug Ingram when I was a second-year resident at New York Medical College, obviously many, many years ago, when he talked, he lectured the students and told us about the misalignment at times between psychological time and chronological time. It made a lot of sense then, and it is no coincidence now that I will be quoting him extensively towards the end of this presentation. So many aspects of chronemics that are of relevance in our field. Commuting time, which doesn't exist anymore when we do video sessions. It was time for meditative activities, it's time for consolidation of memories, and time for relaxation, and also time for activation of affects. Waiting room idle time is really not so idle, time for introspection and relaxation. The timeliness and punctuality of psychotherapy sessions now has been sort of artificially bridged with the advent of video teletherapy. And the ability to be retrospective and prospective determines personal fulfillment and solidifies cultural identity. Now, what I have observed, and we can discuss this in the Q&A, is that people, when doing video sessions, at least at the very beginning of the process, there's a constriction in the ability to travel back in time and to be prospective, and there's more of a here and now focus in the psychotherapy process. And I will spend a little bit of time now talking about silence. Communicating with silence is an important aspect of psychotherapy, and Bruneau himself describes silence in he describes silence in 3 dimensions: psycholinguistic silence, interactive silence, and social cultural silence. In psycholinguistic silence, cognitive functions occur during hesitations. And this is important for us to understand. Grammatical, syntactic decision-making and lexical or semantic decision-making take place during silences. The length and type of hesitation or silence may be related to verbal thought complexity. Longer hesitations could reflect cognitive complexity. Duration of silence correlates with successful task solutions and efficient problem solving. In interactive silence, pausal interruptions in dialogue, conversations, discussion, or debate occur, and it influences interpersonal relationships as well as the exchange of information and problem solving. And decision-making and problem resolution transpire in moments of silence. This is what Bruneau stated in '73. Each member of a dyad or small group makes decisions to speak or remain silent. These decisions also appear to be a function of the interactive context as a function of each member's concept of self. Lengthy interactive silences appear to allow each participant a chance to make inferences and judgments about the many possible meanings of a message. Silence seems to promote movement toward interpersonal closeness. And these are Bruneau's observations about silence in psychotherapy. This is an anthropologist speaking about psychotherapy, and I number them 1, 2, 3, 4 because in the next slide I'm going to give you the references that he used to back up these statements. Silences may allow a patient to bypass seemingly insurmountable resistance, enabling the patient to recoup and integrate psychic forces and enhance the therapeutic alliance. Longer patient silences in therapy may be an indication of progress in therapy and indicative of success. The analyst's silence may be the most important catalyst for free association. And he stated as I guess, an exception or caveat that silence may also indicate limited intellectual capacities, low comprehension, or constitutional or neurotic flatness. And these are the references he offered to back up these observations, conclusions, as statements. A couple of them are in German. I haven't been able to get to those, but I do recommend, let me see which one here is the one that impressed me, the one in the International Journal of Psychoanalysis by Carogueras, Silence as a Technical Parameter in Psychoanalysis. It's an old paper from 1967, but you may want to revisit it. Sociocultural silence, he states, silences are those related to the characteristic way entire social and cultural orders refrain from speech and manipulate both psycholinguistic and interactive silences. Sociocultural silences may define cultural patterns of communication much better than what is said. Silence may communicate respect or disrespect, depending on the cultural context. He states, silence in Asia has commonly been entirely acceptable, whereas in the West, Europe, and the Americas, silence has generally been considered socially disagreeable. This is very, very important when teaching and having a multicultural audience to be able to adapt to our sense of urgency of challenging the silent reception of our lectures or our interactive workshops. Discomfort with silence may also relate to having been silenced and censored by families, communities, church, and state. Silence may reflect conflict or resistance, but there are multiple adaptive aspects to it as well. This conclusion gravitated to us from the field of anthropology. These include complex cognitive functions related to introspection, insight, and problem solving, which are usually accompanied by pleasurable affective states of contemplation, safety, and serenity. Silence allows for meditative creative endeavors, affective regulation, reflective functioning, and integration of the self. And these are more updated references that are easier on our eyes and minds. There is one here, there's a book that was just released a few months ago by Dmitry Jevich. I believe he presented at an academy meeting, and I remember being put in contact with him a while back by Anne-Marie Silver. And he just released a book that's getting very good reviews called Silence and Silencing in Psychoanalysis. It's a collection of essays. Now we will briefly cover the field of kinesics established by the anthropologist Bert Wistel. To read the primary sources may be a bit difficult for most of us, but his contributions were extraordinary once you get through the complexity of his writing. I also love his portrait of where he's photographed in movement, and it's not the ordinary portrait of just the face of a person. It's a portrait of a moving person. Kinesics is the study of facial expressions, gestures, posture, and body movement as forms of nonverbal communication. And he defined it, he stated that nonverbal behavior has a grammar that can be analyzed, and words are not the only containers of social knowledge. I believe he was the one who categorically would say that 70% of human communication is nonverbal, and 30% is through the use of words. If you were to ask one of us, we'd probably reverse the percentages. Speech is coordinated with gestures, posture, spatial orientation, and relative position in space. Psychotherapists pay attention to individual motions and complexes of motions as communication processes. Now, video files and parallel screens allow for detailed observation of the communicative structure of body motion. Attention to facial expression of emotion is important, but perhaps of equal significance is the orchestration of facial expression, movements of the head and extremities with words and utterances to place emphasis, create nuances, and fluently communicate. Video limits our capacity to examine the complex configurations of whole body movements, but may provide a closer examination of facial expressions. Birdwhistle used the term kinemorphic constructions to describe the complex configurations of whole body movements. He also refers to motion qualifiers to describe nuances. For example, when we talk about someone has a weak handshake or observing a faint smile. And I want you to, those of you who are physicians in this Zoom call, I believe probably most, if not all, go back in time to first year of medical school and humor me and try to see how many of these muscles of the face and neck you can remember from memory without using mnemonics. There are basically 69 muscles involved in facial expression, 43 in the face, 26 in the neck. What I didn't know until I started looking into this is that we use at least half of our facial muscles when we smile, but we use most of them, if not all, when we frown. It's quite an expenditure of energy. There is what I found to be an interesting, very recent article in the journal Nature, looking at what happens transculturally with in terms of facial expressions and the universality of facial expressions. The paper is called 16 Facial Expressions Occur in Similar Contexts Worldwide. It's like an extraordinary study of 144 countries, an examination of through computer algorithms of 6 million videos, and without having to go into detail, they found that each kind of facial expression had distinct associations with a set of contexts that were 70% preserved across 12 world regions. So this is a 70% concordance in terms of how we communicate with facial expressions. And this is reminiscent of what Darwin said nearly 150 years ago when he made the argument that human facial expression is a universal language of social life. And this is the complete reference, which is available public. It's open access, so anyone can read it. By the way, if you want a copy of my slides to access the talks at the end, my very last slide has my email address. You can email me and I'll send you the entire slide deck for you to go over if you're interested in doing looking at some of this literature. And I also, I know that this presentation is being recorded, so people will have also the opportunity to listen to the lecture. Now, these are video clips from one of my most admired colleague at Columbia University, and that's Dr. Beatrice Beebe. And as many of you know, Dr. Beebe does parent-infant observation and has a laboratory where she does like a microanalysis, second or even fractions of a second analysis of the dance, to use Richard Brockman's terminology, that occurs between caregiver and infant. But she also inserts herself in the lab as a stranger with the infant. I will not show you video clips, but I'm just showing you 3 stills from a recent video that she just put up on YouTube And here's the link for you to watch the entire video. This is a 30-minute video, but these are 3 clips. And let me tell you a little bit of the story behind this particular diet. The mother is a research assistant in the lab who had this baby who's 4 months old. And for the first 3 months of the baby's life, he was very colicky and unconsolable. And the mother was very distressed because it was so difficult to care for this baby. But then something happens, like most babies get over colics at month 3, but the mother was not fully attuned that the baby was already okay. And she was still reacting with great distress at cues that the baby will send her. It was almost as if she was sensitized and traumatized by not being able to comfort the baby for the first 3 months. But here the baby is actually looking at her in a perplexed way, sort of tilting her body around. And while the mother is using absolutely every facial and neck muscle, frowning as if the baby is experiencing distress, but the baby wasn't in this particular moment. Here you see a very synchronized interaction where there is like precise mimicry of facial expressions. And this is my favorite clip, where you see Beatrice interacting with the baby in the most entertaining way you can imagine. The baby, like most babies, had some stranger anxiety, and Beatrice is sort of a very colorful, has a very dramatic presence. And at one point, the baby started in the video. You see that the baby starts crying and sort of falls apart in the middle of the interaction and goes from great comfort to discomfort. And she completely turns off her face, almost in a robotic way. Stops with the grimacing and the facial expressions of her own, and gently places her hand slowly on the baby's abdomen. And the baby, still crying, stares at the hand, starts playing with the different fingers, then pushes the hand away, stops crying, and she's able to de-escalate the situation with containment. As opposed to what the mother was doing, which was, an amplification of the baby's distress. Okay, so now we move on to paralinguistics, and we'll review the contributions of George Treasure. And you have 2 article sources here that are quite approachable and interesting if you would like to search them. Paralinguistics, also known as vocalics, addresses aspects of communication involving sound but not words, including non-phonemic, non-verbal communication. Paralanguage functions include prosody, loudness, pitch, intonation, musicality. Vocalics modify meaning, they give nuanced meaning, or convey emotion. Voice qualities include pitch range, pitch control, rhythm control, and tempo. Vocalizations include vocal characterizers. Think of what happens when we yell, or person moans, or whispering. Voice qualifiers with measurable intensity, pitch, and duration. And vocal segregates. The favorite one of psychoanalysis is the first one and the second one here. What we do with our patients as a way to echo, validate, and find comfort with our nonverbal vocal segregates. Paralanguage functions are used to express emphasis or avoidance and may be difficult to evaluate through video. So this is something that gets compromised when we're doing video therapy. In addition, unwillingness to adjust, find adequate settings may present as resistance in teletherapy. Briefly, I'll tell you about haptics. It's nonverbal communication through touch and proprioception. We do not touch our patients, but our patients touch surfaces. They touch the interface of telephones, the mouse pad, the screen of an interactive computer. They're important for virtual communication via the touch interface of smartphones, tablets, and keyboards. Haptics and transitional objects in the office space are underestimated in our observations. And we do know that for the youngest, touch promotes well-being, and for adults as well. The sense of touch, including proprioception and haptic perception, is mediated by a complex and interactive neuroreceptors signaling upon stimulation via neural pathways, the somatosensory brain cortex. And again, to take you back to your early years of medical school, touch receptors are contained within the skin, and they include some very sub-specialized designated nerve endings and corpuscles, the Pacinian corpuscles, Meissner corpuscles, Ruffini corpuscles, Mottle cells, free nerve endings. I hope I'm not giving anyone PTSD from activating those emotional memories. And these are involved in sensing vibration, positional changes, light touch, movement, sensation of shapes, perception of pain, pressure, temperature, stretch. The complexity of this biological system is also reflected in the intricacy of cultural norms regarding touching as a way of communicating. Although social touching varies in its expressions across and within cultures, it is indispensable to express emotional closeness and modulate relationships through contact and boundaries. Haptic communication stimulates the production of growth hormone in infants and mediates emotional attachments later in life, with measurable changes in circulating neuropeptides, such as oxytocin and vasopressin. And multiple references here, including our own Joanna Chambers and one of the most read papers in the history of our journal, the Neurobiology of Attachment. And the last two references are important ones as well if you're interested in haptics. When boundaries of personal space are transgressed, psychological discomfort may present as difficulty with attention, concentration, feelings of derealization, depersonalization, and dehumanization. And now I'll begin to quote the work of Doug Ingram and Kim Best. The advent of the COVID-19 pandemic led to the almost immediate restructuring of clinical care. With few exceptions, telepsychiatry became the mode for the delivery of psychiatric care. While physical proximity cannot be achieved when people are connected virtually, perceived proximity can be attempted, and it may be crucial in the effectiveness of virtual communication technologies and teletherapies. Ingram and Best state, our minds are tricked into the idea of being together when our bodies feel we are not. Dissonance is exhausting. It's easier being in each other's presence or each other's absence than in the constant presence of each other's absence. Ingram and Best believe that the fatigue reported with virtual meetings reflects an intermediate state and necessary grief for lost customary structures. We will adapt to video sessions, they say. Once we adapt, the fatigue will fade, the qualifier virtual will disappear. When we speak on the phone, we speak to each other. Nothing is experienced as virtual there. From attachment theory, we learn that nonverbal communication is an essential aspect of interpersonal bonding, and attachment behaviors lead to security in those who are vulnerable, and that includes our adult patients as well. So a summation now of some of the points that this presentation addressed. Cultural anthropology studying nonverbal communication emphasized that up to 75% of what we communicate is executed without the use of words. Nonverbal communication is mostly outside of conscious awareness. Attention to proxemics, paralinguistics, haptics, kinesics, and chronemics may enhance the practice of psychotherapy. The fatigue and the realizing aspects of teletherapy may be bridged when recreating a psychological space that is internalized as an approximation of in-person live interactions, or when the virtual space is maintained constant, predictable, and attentive to the needs of the patient. While the classical psychoanalytic tradition emphasized the supremacy of language as the most important means of expression in clinical settings, contemporary psychodynamic practitioners, in particular those who recognize the validity of attachment theory, have been equally attentive to all dimensions of nonverbal communication. During the second half of the 20th century, American psychoanalysts worked closely with cultural anthropologists who were interested in the study of nonverbal communication. Anthropologists developed the fields of proxemics, paralinguistics, haptics, phonemics, and kinesics in order to study how individuals communicate nonverbally. Borrowing insights from psychoanalysis, anthropologists observed that most nonverbal forms of communication are unconscious and culturally determined. Research on proxemics and other aspects of communication resulted in an extensive body of work that influenced allied fields not only of psychology, but organizational behavior, communication technology, sociology, marketing, and advertising. Proxemics studies how persons use space within the social matrix. Paralinguistics pays attention to aspects of communication that involve sound but not words. Haptics refers to communication through touch and proprioception. Chronemics examines the subjective aspects of how individuals experience time. Kinesics is the study of communication via facial expressions and body movements. And here is a way to reach me by email. You may, if you don't have my email, you may want to jot it down, and I will oblige and send you a copy of my slide deck. Thank you very much for your attention.